There have been numerous recommendations to the Central Tariff Committee over the years for increased technical fees for certain procedures. The best example, for example, is in the case of EMG, electromyographic studies, where we're testing muscles and nerves, and also brainwave tests, where we're looking for epilepsy, for example, or other disturbances of consciousness, coma, and so on. The technical fees have been static for decades, Consequently, it can take months and months and months to get an EEG. Well, if you have epilepsy, you don't want to wait months and months and months for an EEG. You want to get your EEG done within a week or two. It can take months and months and months to get an EEG. And that is because all of the work is now being done in hospitals. There's absolutely no incentive for this work to be done in private laboratories where they could be done more efficiently and more effectively and more timely way, because the technical component, that is to pay for the technician, to pay for the machine, to pay for the supplies, to pay for the rent, is far greater than the technical component that we're paid to do the work. Consequently, in Toronto, there are no private EEG laboratories, or very, very few, simply because it doesn't pay to run them. This is but one example of the kind of things that we would like to see happen, and they've been sort of sitting, gathering dust at the Central Tariff Committee for years with no action and no government approval, and it is extremely frustrating for us because we cannot do our job. For ultra-complicated cases where we have very prolonged encounters, we're also asking for increases in detention fees. We really want to see the hospitals upgrade the laboratory facilities, including these laboratories that we talk about, the EMG and EEG labs. Many hospitals are closing these facilities because they are not profit centers. Well, I was always working under the impression that the Canada Health Act and hospital care and health care shouldn't be profit-driven. And yet hospitals are routinely closing up these services because they are not profit centers. Give me a break. We need the service. Let's get the service. We need realistic follow-up codes for our services. It's an insult to be paying neurologists to spend 15 to 30 minutes with a patient in follow-up and getting $30 in return. There's absolutely no incentive for us to see patients with complicated disease and follow-up at these ludicrous low fees. We would also like other incentives, and I think they're realistic, continuing education incentives, and we would particularly like to see in the community-based clinics for chronic neurological problems. It doesn't make sense for patients to have to travel 5 or 6 hours to go to a special clinic for Parkinson's disease or for stroke prevention or whatever. They should be able to go closer to home for that care, and we would like to see comprehensive clinics for this, these kinds of conditions set up in local communities with the appropriate ancillary services like occupational therapy, physical therapy, kinesiology, etc. These can include Parkinson's clinics, multiple sclerosis clinics, and so forth, that will make available essential services to people with chronic neurological problems close to home. I think this is a reasonable suggestion. I think it's doable. It's practical. It would be cost-saving. It would save a lot of time and trouble for people who often have serious disabilities. These are some of the things that we have been proposing. We have others. We would love the government to sit down and talk to us. We'd like the Minister of Health to speak to us. He spoke to the neurosurgeons in a hurry after 160-odd patients had to be flown to the United States over 1.5 months for critical neurosurgical problems. The government has had no problem introducing a smoking ban in cars. We support that, of course. We don't want children exposed to tobacco smoke in motor vehicles. So when the government wants to do something in a hurry, they can do something in a hurry. The situation in neurology does require urgent government attention, and we beseech the media to get the message out. We implore the public to ask their MPPs to do something about the problem, and we would love to speak to the Minister of Health and tell him how we can solve this problem together. Thanks very much.